edxvideo.com. Thank you.
So I'm already recording at 14
Yeah.
seconds. I mean, I could have hit that.
Okay, I can do
I could
it.
have hit that red button to start recording.
It's alright.
Here we have Mr. Carlos Jose.
And Chad, who did the How to Start an IV series, is 70,000 views plus already.
Chad's one of our charge nurses at Cartersville Medical Center, Emergency Department. Correct insertion of a sterile technique for an ED.
So one of the things you want to do is to help yourself the most. So bring the bed up and the head of the bed down so that there's venous pooling and the veins distend. Make sure you get up close so they can see it well. I already distended. I already chickened out and put a little numbing spray.
Where?
My neck.
On that side? Really? You put numbing
On both
spray?
sides, I don't know. Dude, I don't want to be yelling in the camera, you know.
Alright, so we're going to raise up the bed a little bit, just a little bit more. It's always helpful. I always tell my patients what we're going to do is raise it up. It's for your own benefit. It makes it a little bit easier. I want you to take your right hand and grab that rail over there for me. Thank you. And we'll just drop this down just a little bit. You're going to feel like you're going to fall. That's why you got to hold that rail over there, okay? And what you want you to do, I want you to look over to your right. Always examine both sides, although we're realizing we're going to do it on the left side. We always examine both sides for basically our largest vein that we can actually find. You have an external jugular and you have an internal jugular. This is your external jugular running, as you can see right here. You actually have a cave. You have a deviation between the large jugular here and on both sides. We also look on the other side to examine the other side, see what we have over there. Obviously this is not as large, so we've chosen the left side to actually do. Now, at this point in time, what you want to do is you want to prepare the patient by telling them what you're going to do. This is a procedure that will scare some people, so they want to be aware of we're going to be putting a IV access into your neck. Now, that being said, the skin is a little bit tougher, a little bit harder to access, so we want to use usually a large bore needle, a 20 gauge, a 18, something that actually pierces and cut through the skin really quickly. This is something that you want to do on the first day. You won't be fishing around in someone's neck. There's a lot of veins, arteries, nerves that you don't want to hit on a patient. So we want to clean the area very well. Using proper PPE and proper technique, we want to scrub this area very well. The more you stimulate this area, typically the less it'll hurt is more. It will also open this up a little more. Now when you're talking to the patient, you tell them what you're doing. I'm going to clean your neck right now to make sure this is very clean. This is not a sterile technique. We want to get as aseptic as possible in this area. You want to pull down their collar here a little bit just so you can see, get your perfect access of what you're actually looking for. Now when I tell you to, what you're going to do is you're going to have the patient bear down like they have to have a bowel movement. And what they'll do is they'll bear down for me one time, thank you. Now breathe. The most important thing in this procedure, I know it's a little bit scary, the most important thing is to actually breathe. Because if you hold your breath, it will actually dip down and be harder to access. We have all stuff that we'll need. We'll access it. We'll get our Cathlon. This will be a 20 gauge that we'll be actually accessing with this area. We'll put our hands on here. And what we're going to do is we're going to talk to the patient and breathe in for me and breathe out. Just keeping them calm works best. Breathe in and breathe out. On the next exhalation, we'll actually put the needle in, okay? So we're going to breathe in real big, and we're going to breathe out. One big pinch here, 1, 2, and 3. And there you go. And you actually see a flashback. One big pinch here, 1, 2, and 3. And there you go. You actually see a flashback. Usually not as strong as you would see a regular flashback on a fetal cycle. We're always looking for pooling. You'll do the Cathlon, insert the Cathlon by itself, and pull out. Be aware, sometimes this is hard to actually cut this off and actually stop the bleed. So we're going to get a good pressure point here. And we get a little squeeze here. Put your Cathlon on, and you can retrieve your blood at that time. Never put on the occlusive or the tape until you actually go ahead and get your blood, because these are always positional. Notice we got good blood retrieval. We'll take this off. We'll go ahead and tape this down.
I was looking for keys.
Put our bio-occlusive on very cleanly.
Okay.
And once again, do not forget, we've got our patient laying on their head, so we want to drop them, breathe them back up. Now, be aware, this will always be, EJ is always positional, so we want to tape it really good. Sometimes you'll have facial hair, you'll have things that'll get caught in these, so we want to tape this really well in that area, clean up your site, tape it really well, and that's how you insert in EJ.
Alright, not as bad as donating blood, but
Very tender spot.
pretty. And then painful to move a little bit.
Yeah, nothing that's very awkward, very unpleasant typically, but it serves our purpose. Let me get that out.
Good to go.
Yeah? Good stuff.